Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
Well, we always have interesting professionals on, whether they're in business, but I like it when they're in the medical world. And most of the time, I'm very familiar with their specialty, but this time is a little different. So Dr. BRIJESH Mehta, who is a neurointerventional surgeon, rushed over to our studio when just finishing one of his procedures. And, of course, everyone wants to know, what is a neurointerventional surgeon? Let's start off with that first, and then we can talk about what you just did.
Sure. So thank you for having me on
pleasure.
the station today. I really appreciate it. So a neurointerventional surgeon, in layman's terms, it basically means performing minimally invasive procedures. So it is not open surgery that most people might be familiar with. And for neurological types of diseases, specifically, vascular disorders within the brain and spine, used to have to cut people open, their skull or their spine, in order to access the actual aneurysm or whatever the problem might have been. But with the advances in the technologies over the last 20 to 30 years, we're able to essentially perform what cardiologists have been doing for a long time, for several decades, which is go inside these blood vessels and use image guidance, X-ray technology, to visualize the arteries, the anatomy, as we're navigating up into the neck and the brain or the spine, and treat the diseases in a manner where it's much safer, and also the length of stay in the hospital and the recovery period is much better.
And it's not as scary. It sounds to me it's not as scary. But the other question I have then, this sounds like, is this robotically done?
It is not yet robotically done. We do think that, there's promise there, and that might be the future in perhaps 10, 20 years. But these days, it is all done with essentially like a video game, if you will. You have the monitor in front of you, and while you're navigating the catheters into these arteries, the very delicate parts of the neck and into the brain, you can visually appreciate exactly where you're going on screen, and utilizing your hands and the very fine motor movements, be able to manipulate these wires and catheters within millimeters of space. So it is very delicate work, requires a lot of patience, and is meticulous, but it is something that allows us to effectively treat a lot of cerebrovascular diseases.
You forgot one thing, your brain. Your brain. I see where you have sterling credentials, just amazing. And so my question was, since this is such an unusual, well, to you it's probably not, but to general public specialty, how did you get interested in this?
Yeah, it's a good question. So I had been interested in neurosciences, the circuitry of how the brain works and all the wiring that's involved in order for us to carry out all the functions that we take for granted on a daily basis to keep us alive and, talk and eat food, taste,
drive cars,
speech, everything. And that probably was in college, towards the latter part of my undergraduate training, when I became really interested, did some research in neuroscience labs at Emory University. And I think that was the beginning of, my interest in cerebrovascular disease, meaning strokes within the brain or spine, bleeding diseases that may or may not be treatable. And it was really learning about a lot of the diagnostic and therapeutic aspects of, these disorders, vascular diseases in the brain, that was very appealing to me, and the ability to make a difference.
I'm speaking with Dr. BRIJESH Mehta, who is a neurointerventional surgeon, and He is affiliated with Memorial Neuroscience Institute. Of course, I know about Memorial, the whole hospital, but then they have a special institute there for people like you. Are there many of you around? I don't mean locally, like nationally. Is this a common specialty?
Yeah, so it is not as common, relatively speaking, as many of the other medical specialties and subspecialties, such as gastroenterology or cardiology, internal medicine. Neurointerventional surgery is a very small group, society-wise, of a few hundred individuals in the United States.
Wow.
And worldwide, it numbers just in the low thousands, several thousands. And the reason being is the training requirements, as well as the types of resources necessary to perform these procedures are not widely available at all hospitals. And so it requires a lot of the resources and investments by hospital systems to provide the type of treatments and care that we are capable of.
Well, yay for Memorial. I'm glad that they're a cutting edge institution anyway, and I'm glad that they saw they need that. But I guess further, I want to put this into a layman's mirror. So if something happened to me, why would I need you? Why? Because I'm going to ask for you. Tell me why I would ask for you.
Right. So when we go out and educate folks in the community about what we do and, from their standpoint, what are the symptoms to be aware of, it's really the bread and butter is acute stroke treatments. And so a stroke is due to a blockage of an artery in the brain. In the United States, the statistics show that there's about 800,000 strokes that occur annually. And these strokes, for the most part, are preventable and very treatable these days, as we'll discuss momentarily. And so for the folks in the community, the signs and symptoms to be aware of are, trouble speaking, trouble understanding what others are saying, all of a sudden weakness in the arm or leg on one side or the other, droopiness of the face, difficulty walking. Many times it's the loved ones, the family members that pick up or witness some of these sudden onset of these neurological difficulties. And we always advocate calling 911 immediately when that happens. Do not wait. The reason being is that stroke, just like a heart attack, time is everything. And, we repeat this over and over out in the community and through public service announcements. Time is brain, meaning the faster you're able to get to the hospital and seek care for a potentially devastating blockage of an artery in the brain, the faster we can get to them, open up the artery, and many times get them back to a meaningful quality of life, meaning ability to regain their neurological function and contribute to society.
Well, Dr. Mehta, since there aren't too many of you around, so so someone goes to a hospital, what would they do before you? Because as I said, strokes have been around a long time. Yeah. They didn't have you. They do something else, but how would they then get you? They'd have to be taken down to Memorial, to the to your institute.
Right, the stroke center. So that's a great question. And, what a lot of folks, I would say, safe to assume most people are not aware of are the advances that have occurred in the acute stroke field over the last 20, 25 years. And so it's important to remember that there's so many people involved in the chain of care for stroke patients. So starting with just merely calling 911, the front line are the emergency medical service responders, the paramedics. And so they have been now trained over the past, 5-10 years as acute stroke treatments have developed to understand what is at stake. So if a patient is calling 911 and saying, or a family member is reporting that their loved one is found down, they cannot get out of bed, cannot talk, the paramedics are being educated actively, and that's what we've been doing at Memorial through our community education, to understand that that could be a devastating stroke. and to bring the patient immediately to what we call a comprehensive stroke center, which are stroke centers where they have these neurointerventional capabilities 24/7 year round. If they go to any hospital that is not a comprehensive stroke center, significant delays can occur in order to then diagnose correctly that it is a acute stroke due to a blockage of an artery in the brain, and then to get them to the appropriate facility. It can take hours to, get them out of what we call a general hospital primary stroke center and to a comprehensive facility like Memorial.
And that time is wasted because it's harder,
Absolutely.
isn't it, for you?
Once they get to the appropriate center, a comprehensive stroke center, then the next step of physicians and nursing personnel are the emergency room staff, and they immediately examine the patient, take them to the CT scanner, and try to figure out, number one, is this due to bleeding in the brain, such as from high blood pressure, smoking, etc., or is it due to an actual blockage of an artery? So we perform now sophisticated imaging right there in the emergency room within just minutes of a patient arrival. And that happens because the emergency medical responders call in through Medcom and say, look, we have a stroke coming in. We want you to be prepared so no time is wasted, just like what they've been doing for heart attack victims for the last 30 years. And so that way we even activate our cath lab as soon as we hear from the EMS personnel, so that as soon as a patient arrives, everything is ready. And within an hour of diagnosing a blockage of an artery on CT, we can take them to the cath lab, start the treatment.
Wow. It takes a lot of people. It says like it takes a village, right?
It does. And the data shows that, about 1.9 million neurons are at risk in the brain for irreversible damage every minute that elapses until that artery is opened up.
My goodness. Well, so let's talk about the person that you rushed here to get away from a surgical procedure. It was that the same kind of thing, or is there something else you can share with us?
Sure, absolutely. We've had many, complex cases, challenging situations, not just recently, but just, based on the type of diseases that we see and encounter, it allows us to gain steady experience, year round. And so recently, just over the past few days when I've been on call, we saw a patient that came in with a large ruptured aneurysm in the brain. This was just on Sunday, a lady in her 50s that came in complaining of worst headache of her life. And those are the signs and symptoms we worry about, that this could be due to bleeding in the brain because of high pressure, which is hence causing the headaches. And these aneurysms can be due to smoking, family history, and it's from weaknesses of arteries in the brain. It forms these balloon-like outpouchings. Her aneurysm was right there in front of the brainstem. Had she not sought appropriate care that Sunday, she unfortunately would not have made it. So we diagnosed her by Sunday morning, took her to the cath lab, and sealed off the leakage within the aneurysm. And today she's up in bed and, out walking, sitting in a chair.
And no damage, no
and
permanent
no brain
damage.
Correct.
Well, no wonder you love your profession. That's pretty exciting.
It is. It's, I would say, probably one of the most satisfying things that you would ever see, to witness a patient that comes in with, these types of aneurysm ruptures versus, even these blockages of arteries in the brain. At one moment, they come in completely paralyzed on one side of the body, unable to lift their arm and leg, unable to speak. And if the treatment is successful, which many times it is, 7 out of 10 times, this treatment that we do in the cath lab to remove the blood clot is very effective. And literally right there in front of you, as the blood flow is restored in the brain, they will start speaking, lifting their arm and leg to command, and within a couple of days able to leave the hospital. This was unheard of even 5 years ago. This treatment, this came about, fairly recently due to advances in technology. And that's why we're out here educating the community, participating in.
Yes, we appreciate this. So people are aware of it because, as you said, it was pretty much, well, that's it. They're a goner, right? But now you said if they can get to the hospital in time and the personnel there knows what they're doing and they understand what they can have, because not everybody can get down to where you are at Memorial. So I guess what you're doing, are you, going to other hospitals and trying to educate the surgeons?
We do, yes. And in South Florida, across the Tri-Counties, so Palm Beach, Broward, Miami-Dade, there are several comprehensive stroke centers. And what we have tried to do as a collaborative effort with other neurointerventional surgeons across these systems is to work together. We created what's called the Tri-County South Florida EMS Stroke Coalition.
Wow.
And we did this about 3 years ago. I'm one of the co-founders. And the aim is to educate emergency medical services in the community to recognize signs and symptoms of a stroke and take the patient to the most appropriate care facility.
I did notice in your bio that you also deal with pediatrics. Now,
we do.
It's interesting because usually I've asked other surgeons, they say, no, that's a pediatric surgeon.
Right.
But you're able to do the same thing with a child.
Yes, absolutely. So because the training pathway involves both managing adult patients as well as pediatric cerebrovascular diseases, we are skilled in treating babies, kids. Thankfully, they do not have as severe or as common of these pathologies as adults do, such as blockages of arteries in the brain. But when it does happen, it's, as you may understand, it's much more critical because they have their whole life ahead of them. And if we can fix some of these arteries in the brain that might be causing bleeding, such as arteriovenous malformations, which are not uncommon in pediatric populations, then hopefully we can provide a meaningful life for them.
Because a child can't really, I think, communicate the same way what's wrong. It's up to the parent or someone, a teacher, somebody that says something's not right with that child. They're not walking right, or they have a problem with their head.
Yes, definitely. It's usually the parents, the family, siblings that pick up on, if something's wrong with the baby at home or the child. Like you said, they're not able to express what is happening to them. So we always educate that if something does not look right, if they seem very drowsy, lethargic, meaning just weak all over, not themselves, nausea, vomiting, not able to, do their feedings, then always call 911. At Memorial, we are fortunate to collaborate with the Joe DiMaggio Hospital. And so as a multidisciplinary group, we work with our pediatric neurosurgeons. And just an example, about a year and a half ago, and we've had several more of these success stories since then, but this was one of the most memorable ones for me because of the age of the baby. She was 10 weeks old, and the mom just could not figure out why she wasn't behaving herself and not feeding appropriately. So she called 911, brought her to Joe DiMaggio, immediately did a CT scan. It showed extensive bleeding in the brain. So we did additional advanced imaging, non-invasive, and found that it was due to what we call a arteriovenous malformation. So it's a bundle of blood vessels that individuals are born with, and she had ruptured from this abnormality, this AVM. And so we actually performed a minimally invasive procedure in the cath lab, got all the way up to where the AVM was located near the top of the brain, and sealed it off. And within, I would say, a matter of several weeks, she made a full neurological recovery, was up, behaving appropriately, just energetic, and on follow-up visits, she has no neurological deficits.
I'm sitting here with my mouth open because that's quite a story. And especially for you as the surgeon and somebody who, wanted so much to help that child.
Right.
Well, that's a beautiful story. I want to just tell everyone again, it's quite a privilege to have Dr. BRIJESH Mehta here. He is a neurointerventional surgeon, and he actually is the medical director of the stroke and neuro medical care. No,
Yes. Neurocritical care.
neurocritical care. Stroke and neurocritical care. So it is critical, right? Stroke and neurocritical care. And you have lived here in South. I know you have been educated all over. As a matter of fact, I heard you say my son actually has a law degree from Emory, and it's a wonderful, wonderful university. And I see where you've done a lot of things at all the fine universities. I believe you even did something at Mass General, Brigham and Women's Hospital, and I mean they chose you. I can see that they saw that you're enthusiastic and smart. And do you have a family? Do you have a family in medicine?
I do. So several of my
I know that happens.
family members are physicians. My parents, they told both my brother and me to pursue whatever career that we were most passionate about. And that meant a lot to me that, despite having several, family members, extended families in medicine, that we were not boxed into any specific profession. And it's just coincidence that, as time evolved and we learned about the career options and what was out there, that this is something that I absolutely loved, and after a while realized I don't see myself doing anything else.
Sure.
So
and you're young yet, so you have a lot of years to pursue this. And if you could wave a magic wand, what would you like to see that you can't be able to help or do right now? What would you want science to discover?
Yeah, so that's a great question. I think in our field, the biggest challenge we have is, despite all the technologies available currently to treat patients in the cath lab, use our, minimally invasive techniques, that sometimes we unfortunately just cannot help everyone. And that is because when, for instance, you have a blockage of an artery in the brain, or you have neurological injury due to trauma, there are a handful of, these diseases that are just very devastating, because at the time of insult, the time of injury, it irreparably sometimes will damage the neurons. And so if we can have a shot at some promising neuroprotective agents that patients can receive, even en route to a comprehensive stroke center via EMS, that can be administered in the ambulance, to start salvaging some of those neurons, so that by the time they get to the hospital, then hopefully they have not extended into a massive stroke or a lot of bleeding, and that we can get better results after the treatment. Because you see, sometimes we open up these arteries in the brain in the cath lab, but unfortunately the patient still remains debilitated. And it's because on follow-up imaging, by doing an MRI, we're able to see exactly, more precisely, what areas of the brain are damaged. Many times there's large areas of stroke despite restoring blood flow to the brain. And that's what we call patients that evolve their stroke very quickly, even before they arrived at the hospital. And so if we can somehow slow down that process, that damage that occurs until we get to these patients, then I think that would be the holy grail.
That's excellent, but I have another question about this. Now, I had another physician who had written a book, and The Brain That Heals Itself, Dr. I forget his name right now, but he's the one that talked to me about plasticity.
Yes.
And you probably know who I'm talking about. I don't remember his last name, but
yeah,
he's very smart.
There are several neurosurgeons, neuroscientists that have, worked on some of these books, literature.
So tell me about that. So once you said, so let's say that person's had this stroke, and by the time you get in, they've had a lot.
Yeah.
But he explained, and if I'm remembering correctly, that there are other places, though, that can now take over,
compensate. Yes, that is true. It also is more likely to happen the younger the individual. For instance, if we see patients, unfortunately, stroke afflicts patients in their 70s, 80s, and 90s, more so, thankfully, than younger individuals in their 20s and 30s. The older individuals do not have as much reserve neuroplasticity as the younger population. And so the cards are stacked against them, if you will, and, to allow for a meaningful recovery if there has been already a large stroke that's established or injury that has occurred due to trauma. Younger individuals with strokes of similar sizes, magnitude, I've seen many times after restoring blood flow in the cath lab that despite the size of the stroke, 6 months later, a year later, they have regained much of their neurological function is because the surrounding areas, as a result of plasticity, is rewired and taken over some of these functions. And so this is, again, where these neuroprotective agents will be helpful because as we all age, as expected, that atrophy occurs in the brain. Just as muscles in the rest of our body atrophy, the brain is no different. And so when that happens, we have less reserve in the brain and less to work with.
Boy, Dr. Mehta, I've loved this. We're going to have to get back, have you come back, write some articles for us. This is such cutting-edge information. I can't thank you enough for taking your time to come and talk with us.
My pleasure. Thank you so much.